This afternoon, Ghana is set to roll out clinical trials for 2 separate COVID-19 vaccines as it joins global efforts to gather more information on how to defeat the virus. About 1,500 volunteers will receive at least 1 full dose of the Russian-made Sputnik Light vaccine or the Sanofi vaccine in a space of 13 months. Already, similar trials are being run in at least 8 other countries, including the United States of America, Russia, Egypt and the UAE. But with the current global shortage of vaccines due to vaccine nationalism, Ghana's participation in the advanced clinical trials will better position it to access the jabs when they are finally ready. Here is team lead for the trials of the Sputnik Light in Ghana, Dr. Alberta Amu, addressing a national stakeholder conference a while ago.
Designed is a randomized, double-blind, placebo-controlled international multi-site study. The duration of participation is up to 201 days. There's a screening period of up to 7 days. Then there is vaccination. Then a follow-up period of 180 days, plus or minus 14. The locations for the study are United Arab Emirates, Russia, Ghana, and Egypt. The study will cover participants who are 18 years and above and are healthy. Throughout the world, there will be 6,000 participants. The random allocation will be 1:3. 1 of active IP to 3, I'm sorry, let me take it again. 1 placebo, 2, 3 IP. Random allocation. So in Ghana, there are going to be 2 study sites, the Dodwari Health Research Center, and the team will be led by me. We are going to recruit a total of 500 participants. In Navrongo, they will also recruit 500, and the team is led by Dr. Nana Kosi-Ansah. The study will start on the 28th of June, and the schedule of events will be: number 1, the first after community mobilization and sensitization. The first visit will be screening. After participants have screened and those who are found eligible and provide informed consent, written informed consent of active participation in the study will be vaccinated. This will be followed up by phone call daily up to 21 days and then weekly thereafter. The second visit, which will be observation at the clinic, will happen on day 42, and then the study completion visit will occur on day 180. These regulatory and ethical bodies are providing the oversight for the study. So community entry and engagement has already begun, and we've held and we are still holding stakeholder meetings at national and district level. We've already started with community engagement of opinion leaders, religious groups and leaders, health workers, community-based organizations, and community members.
Well, Manuel Kranting was at the conference, is joining me so he can give us some more details of what actually went on there. Hello, Manuel.
Yeah, Gifty.
Manuel, let's begin with the specific details of each trial. Take us through it.
Also, there are 2 different trials that we're going to have. One is going to be on the Sputnik Light vaccine. And just like you heard Dr. Alberta Amu mention there, there are a total of 1,000 subjects who will be receiving the Sputnik Light jab under this particular trial. And there are 2 sites for the trials, one up north in Navrongo and the other down south in Dodoa. Now, essentially, these 1,000 people are going to join some 5,000 other participants of this particular trial from across the world, specifically from Egypt, from the United Arab Emirates, and then also from the Russian Federation. And so essentially all of the recipients of the vaccine are going to be put under close monitoring. And there's going to be 3 stages of visiting. The first visit will be the vaccination day, and after 42 or between 42 and 46 days, there's going to be another visit. And this period is essentially going to be the period of observation. And then after that, the study will be completed between a period of 180 and then 201 days. That is for the Sputnik Light vaccine, Sputnik Light vaccine trial. And Gifty, you know that it's indeed come up the Sputnik V vaccine and then the Sputnik Light vaccine. I'm sure we'll get there. But essentially, the vaccine was obtained by a biotechnological method without use of a pathogenic SARS-CoV-2 virus. And the basis of the vaccine are recombinant vectors, of course, the special structures created in the laboratory to help deliver the drug active substance into the body. And so this is the entire process that is going to be carried about. Now, the study will be conducted according to a protocol reviewed and approved by the Dodoa and Navrongo Health Research Centers Institutional Review Board, the Ghana Health Service Ethics Review Board, and then the Ghana Food and Drugs Authority, because we are told that there's going to be strict monitoring all through the 201 or so days that this particular trial is going to be embarked upon. And so it's essentially to ensure that the data collected from the study is done scientifically and the rights and well-being of all the persons participating in the clinical studies are respected. And you heard her say that even before the beginning of the trial, a written and signed informed consent form will be, obtained from the participants, just so that no one is coerced into, participating in the trial. So everything will be at will, and we are learning that will be by the use of volunteers, as has been the standard practice across the world. And those who qualify will and are still willing will be enrolled into the study. There's going to be a screening of the volunteers before they are put onto this particular study. And so between 1 and 201 days, that is what's going to happen with the Sputnik Light vaccine. Now, the other one is going to take a period of 13 months. So Sputnik Light is taking 201 days. That's give or take between 6 to 7 months. But the Sinopharm vaccine is going to be for the period of 13 months. And now the number here is not 1,000 like you have in the Sputnik Light trial. The number is 500. The number is 500. And the countries that are actually joining Ghana in this particular study are Kenya, Uganda, Honduras, and then the United States of America. And so in total, even though Ghana is taking about 500 of the volunteers to undertake this particular study, in total, there's a global number of 16,000 people who are undergoing this study. Gifty.
Interesting. So let's take a look at the responses of the authorities when it comes to the Delta variant, which is said to be resistant to the Sputnik V vaccine.
Well, so I spoke to Dr. Abraham Odro, who is the director at the Research and Development Division of the Ghana Health Service, and of course, Dr. Franklin Esidu-Bequin, who is Director in charge of Public Health at the Ghana Health Service. Both of them have been, serving assurances that indeed the protocols at the airport, which involves the screening of all arrivals at the airport, is stringent enough to be able to pick out and isolate all the cases that are entering the country. And this was the same protocol that was used for the UK variant. It essentially ended up in the larger population, which contributed to what has largely been referred to as the second wave of the COVID-19 virus in the country? Well, I put that question to them, and their answer was that at this point, the science and data does not support the entry of the Delta strain of the COVID-19 virus within the larger population. And this is why. When you have, an essentially competent strain of the virus like that, you're going to see a surge in the cases that are being reported at your various health facilities. At the moment, that is not the case within our context as the Ghanaian community. And so he makes the point that even though we cannot necessarily say that the Delta strain of the virus is not in the community, the data shows that there's no, adversely potent strain of the virus in the community, for which reason there will be an upset of cases. And so at this point, they are going to upscale the protocols at the airport while emphasizing on the need for all and sundry to observe the safety protocols, keep wearing the masks, and observe all the other safety.
Okay, Manuel, thank you very much. Manuel Quantin there covered this particular assignment for us, and so he's giving us the details that was shared there. But he spoke to Dr. Abraham Odro, which is what he was telling us, the information Manuel was giving us. Let's hear from the doctor himself.
The Sputnik V and the Sputnik Light. The difference is that the V has 2 doses. It was 3 weeks apart. And the Light are just the first dose. But the available evidence suggests that the Light has about 80% efficacy compared to about 90% plus in the V. So if you combine the fact that we are going to give only 1 dose, the logistic bit of it, the cost bit of it, and everything together, and looking at some of the available vaccine that we are using, some of them even around 60%, then obviously if we are successful in this study and you're able to prove that the Light is 80%, then it's very good. Because cost effectively wise, to be better to use 1 single dose at 80% efficacy or thereabout means that you could vaccinate more people at a cheaper rate. You can also be people who accept the vaccine even at just a single dose compared to 2 doses. So all these logistic, administration, cost, economics, science, combine everything together, the Light would end up being superior.
Does this have any implication on our access to the vaccine? We know that the Sputnik V, we're having challenges getting it from the Russian government because of vaccine nationalism and perhaps because we didn't really contribute to the development of the vaccine. Does this have any implication on our access to the vaccine later?
When you contribute in developing the product, you have a better chance of being given the vaccine. Normally, the sponsor would either donate some of the vaccines to you, either for free or at a cheaper rate. Because if you are going to compete to procure the vaccine and you have not participated, they are likely to give the one that has participated. The population that participated in the study, they have a right to get the vaccine when it's proven to be good. So it's very good that we participated. There are a lot of evidence that some of the earlier childhood vaccines that we are currently using, because we participated. So that's it. So some countries got the vaccines early because they participated in the study. So that's how it is. They can either give you free, you have the chance of being given priority in terms of pitches, or it could be cost-wise, depending on how the contract is structured. If the contract is structured and say that instead of maybe $20, we'll give you $10 because you participate. These are all some of the things that will be factored into.
So that's Dr. Abraham Odro there speaking to my colleague Emmanuel Quantin. Now, let's expand this conversation a while longer. Like I said, we will be live in India this afternoon. But I have the director of the Noguchi Memorial Institute for Medical Research, Professor Abraham Kwabena, and public health experts have been talking about this. So let's engage these 2 people who are joining me. Prof, thank you very much for your time. Good afternoon.
Very much. It's a pleasure speaking.
Well, we also, like I said, we're live in India and we'll be hearing from the representative we have from India. But Prof, let me start with you. Yesterday, we all heard that the Indian strain has been detected in Ghana as Noguchi Memorial Institute. How did this news get to you?
Okay, the Indian strain has reached Ghana, but there is a certain history that is important. We had a UK strain, we had a South African strain. The UK strain now is in Ghana in transmission. The South African strain was found in travelers, but it has not really taken roots in Ghanaian population. With the Delta variant, what we have seen is Delta variant in people, travelers in Ghana, and then not the population as such. So we still have a chance to be able to contain or to prevent widespread distribution of the virus.
Okay, so that's about the Indian strain, and that perhaps should give Ghanaians a certain level of assurance. But exactly, yes. but public health experts say that the Indian variant, also known as the Delta variant, which is one of the 45 variants currently in Ghana, is an issue of concern because that strain has caused and is still having a devastating effect not only in India, but it's led to a spike in cases in the UK. Despite the fact that last section of the population have been vaccinated there. So those are details that we'll be going into. Now, hospitals and crematoriums are also, as we know, overwhelmed by the daily number of people dying from the virus. And there are reports of widespread shortages of oxygen and medicines in India. So we have a representative, someone from India, who will be talking to us. His name is Shameh Sathar. He's a founder by the startup business community in Coimbatore, Tamil Nadu in India. Help me, Shameh, if I got any of the names wrong. And thank you for your time. Shameh, can you hear me?
Hello, am I audible?
Do you hear me?
Hello?
Okay, well, we'll try this again. Shameh, can you hear me? I just wanted to be sure that I got the names right, your name and the name of the area right as well. Okay, we'll try and get Shameh to talk to us. Prof, let's continue with the conversation. So your indication is that we should have a level of assurance because even though we've detected the Indian variant here, we do not have community spread, which is a point that all the health experts have been making.
Yeah, that's very right.
Okay.
That's very right.
In the meantime, we know that people seem to be letting down their guard. We also know that even though our numbers have gone down significantly, there are still concerns about observation of the COVID-19 protocols. Let's begin with what we should be doing right now. Should we increase the restrictions, for example, in terms of who can come into Ghana and movement at the airport?
That's a very interesting question. You know, globally, the way the world has developed, and if you look at the global vision, even through the Sustainable Development Goals, you can see that the way to solutions that are sustainable or lasting is not by exclusion or by targeting groups, but it is by strategic inclusion and taking decisions that are either intelligence-based or evidence-based that can provide solutions to the challenges. So really, excluding some people or stopping some people from Ghana is not a solution, but rather strengthening our public health, early detection, resilience for the pandemic is the key. And fortunately, that is the direction Ghana has taken so far. So if we continue in that direction, and we also appreciate the fact you made, the point you made earlier on, concerning the responsibility of the populations, then we surely will be able to, manage the situation or contain the Delta variant. So the population must be made aware that they are part of the solution. And then when I say population, I mean individuals in the population. So one of the key things we can do is the legal aspect of the infection prevention and control. If you are in public outside anywhere and you don't use a face mask, it should be punishable as an offense by law. That kind of thing is necessary so that we'll be able to comply to the level that can achieve the result of preventing unnecessary spread.
But Prof, if I may just jump in here, that is what we've been doing, and we realized from very early on that it wasn't sustainable and it wasn't working, because until the people understand the need for them to do this, it is just impossible for our police force as we have it now to man the entire country in search of people who are breaching, especially the wearing of face mask protocol. So isn't it about time, now that we've just detected it, that now you put in place the measures that we didn't back then, which, you know, was attributed to the spread that we had? Isn't it necessary now to now say, let's keep the restrictions coming, you know, now, so we can get a handle on it, and then once we have a handle on it, we can know what steps to take next, wouldn't you say?
Okay, so you see, when you talk of the restrictions in this case, I believe you are talking about restrictions, for example, in travel restrictions.
Yes, especially for those who are coming from India or wherever, this train is.
The Indian intervention solution has already passed. Now the Delta variant is spreading so rapidly in the UK, and it is spreading in the United States of America also, and several other countries. So if you are prepared to put travel restrictions and cut Ghana off completely, then perhaps we'll be heading somewhere. But that will also have its other consequences, that eventually you may find that the Delta variant, if it can get in, could get in anyway, and yet we would have also suffered other socio-economic, you know, unintended consequences. And we have to avoid that kind of unfortunate situation.
So cutting Ghana off completely is the ideal to stop a spread, but it's not possible. As you know.
It's not advisable.
It's not advisable.
Yes, it's not advisable at all.
That will be for the external, you know, restrictions. But internally, what do you think, you know, from a public health perspective,
what we should do is to come back to the drawing board and appreciate what community is about. You see, communities are human beings or societies coming together. Human beings are social beings. And social beings have norms, rules, regulations, values. You see, we have to come back to the drawing board and begin to make Ghanaians to appreciate that in a situation like a pandemic of COVID-19, everybody has a role to play, and that it is a partnership. And the partnership requires that you as an individual, you play your part. And to do this is not too difficult, actually. It is only by having the clear intent and a strategy. For example, what you are doing now that you got me on this platform at Joy News today at this time, is an excellent way to contribute to that kind of movement. And if other media houses will be doing the same thing, perhaps even simultaneously, and then it catches up as a movement, you will find the population beginning to appreciate and comply. That's all that is about. And if you look at Global Vision, Sustainable Development Goals, Goal 17, it talks about partnerships for the goals. Partnerships that can bring solutions to the sustainable. Without certain partnerships, it's not possible. So internally, we need some kind of partnerships, and we have to do that for success.
If I hear you clearly, Prof, and help me here, you're calling for some sort of media campaign, and that media campaign, it won't start in the media. It will have to be, the media will do it bits, but there are authorities, there are agencies that are responsible for this. Shouldn't the campaign start from there as a way of dealing with this new strain that we're discovering?
I like that very much. But already, if you look at the Ghana response, you will notice that the authority, as for example, in the state or the government, has already taken very beautiful steps in that direction. That is how come the entire COVID-19 response was centered at the presidency. And the president himself became the lead person. So already something has been done. And one thing about development and society, especially about sustainable development, is that it is not the president, it is not the government that brings about breakthrough sustainable development. They only provide an enabling environment. What brings about breakthrough sustainable development is initiative and innovation from individuals and groups in the community or in the society or in the country. That's what brings innovation and breakthrough. We have to understand this as a nation. And therefore, the media can take its stride. Institutions and groups can take their strides in this kind of direction. And you will be amazed because the enabling environment already has been primed. What is left is initiative and innovation.
Well, Doc, Prof, let me just hang on and bring in the person who is joining us from India so that we can learn a bit more from their own experience. We know that it hasn't been easy for that country at all. Shameh Satha is founder of By the Startups Business Community in Coimbatore. And I hope that I got the name right. Shameh, do we have you there now? Right. So, Shameh, let's start with the situation in India today. How will you describe the situation, the COVID situation in India? Hello, Shameh. Shameh definitely hears me, but it looks like I'm having a difficulty hearing him. Prof, I'm going to come back to you about how typically, and I'm sure that with what's happening in India, in the UK, and in the US, you have been monitoring it. And a virologist told me once that we don't need too many people to be infected for the virus to go around. It started with 2 cases here in Ghana, and then we have more than 700 people dying now. So with your experience of how these viruses spread, knowing that this particular variant is alien to us, I mean, even though we know a little bit about COVID now, we don't know about this strain at all. Walk us through how typically this would spread and the imminent danger there is if we don't do what we ought to do. Hello, Prof.
It happens this way.
Okay.
You see, once a person gets infected, and that person is able to pass the infection on to one person, it means you are sustaining the infection. If that person who got infected can pass it on to more than one person, you are already in the spread. It means you are going to go into an exponential spread. It will multiply and multiply over a short period of time. So the first thing is to be conscious that a person who is infected should be detected early, isolated or quarantined properly, so that the spread does not become magnified. But it is a little difficult, especially in our part of the world, where most of the infections are asymptomatic. It will be difficult to detect those who are infected, who are spreading the disease. And this is one reason why it is about time for us to begin to jump into what I said, initiative and innovation. We have to move that way so that the country can be protected. One good way to do it is to open up antigen detection tests that are very, very accurate. Some of the antigen tests now are about as sensitive as a PCR. So it is important to begin to use these in strategic ways so that people who are asymptomatic but could be spreading could be picked up quickly. Now, I'll give you a very dangerous scenario, something which is challenging to us as a nation. When you look at the population, people have homes, they live in homes in families. The families at home, they don't wear face masks, for example, in the house.
Yeah.
But members of the family may go out. They will protect themselves by wearing face masks and complying with all the protective protocols. But if per chance a family member were to get infected, and the member may not know because of asymptomatic infection, he or she comes home And there's a potential to now begin to spread because in the home nucleus proper, you are not following all the regiment routine. So you see, that is one avenue that if we are not careful, we can multiply coronavirus in our populations without really knowing what is happening. And therefore, it is important for us to also use some of the technology advances and breakthroughs. Expanded testing is crucial so that antigen detection tests that are very sensitive could be made available strategically so that such people could be detected early and then the family will be protected. You see, we have to be thinking innovatively, practically, like how I'm trying to explain now. That way, you can avoid a spread of Delta variant.
So we should expand our testing regime and go more for the antigen test, which would help us deal with this situation. I want to. Yes, I really want to hear the perspective of the Indian who has joined us, so that I'll take your thoughts on what he says and how it relates to us. And let me give it another shot. Shameh, can you hear me? Do tell us what the situation in India is at the moment.
Thank you, Joy News, for the opportunity. To start off with, most Indians are struggling to cope with the mental fallout of the coronavirus pandemic. Indians are facing a second health crisis brought on by the coronavirus pandemic, fear and anxiety about the disease, and the overwhelmed healthcare system has spread through the population, causing a decline in mental health throughout the country. The impact of COVID-19 has not just been the obvious physical one. It is surrounded by pain, deaths, and isolation in most families. It is having a huge impact on people's mental health too. Senior citizens are one of the groups most at risk from coronavirus, have seen their health deteriorate significantly in the past months, ever since the outbreak of the second wave. Young people have lost jobs and employment opportunities. They have also seen their education and training disrupted at different levels at different points. The long-term impacts of the pandemic will be very severe and take a long time to fix. The proportion of young workers affected by the crisis appears to be even higher than what the government had expected and what the general population has expected.
Yeah.
The big question is whether India's healthcare system remains prepared to tackle the third wave, which is imminent, according to the Indian Medical Council, IMCR. It will only lessen if we have proper vaccination drive carried out at all levels, which has been a matter of concern in many states in India, including Tamil Nadu, which happens to be my state in India.
So I want you to help us understand the extent of stress that this put on the health system. What kind of conversation is going on in India about what you could have done differently to avoid this spread? Are people talking about this? Are the doctors talking about it? What are the doctors saying about what they believe that the Indian government could have done differently to avoid this spread?
I think vaccination rollout. India reduced vaccination at mass numbers at first level, and then when they started exporting vaccine to different countries like the USA, like in the European countries, what happened was that the second wave, which broke out early during January, or probably I would say in the beginning of February, affected the large Indian population because of lacks of vaccines. And clearly, after the second, outbreak, the second wave outbreak, the government had no real clues of how the vaccination distribution is going to be. There has been a queue of vaccination at all levels, and those people who are affected by the coronavirus had no proper infrastructure to begin with, especially Delhi to start off with, had no proper oxygen facilities. There was dearth of oxygen supply in different parts of Delhi, followed by Uttar Pradesh, one of the most densely populated states in India. Madhya Pradesh and Maharashtra has been affected by severe pandemic crisis ever since the first outbreak in India. And then Kerala down south was affected as well. Tamil Nadu, Karnataka, one of the most advanced states in South India has been affected as well. So the government has to roll out vaccination supply properly. But one hope that has happened in recent time is that yesterday India was able to vaccinate 85 lakhs people, and that's a big record compared to China or most countries in Europe. So this trend has to continue, and if India is able to vaccinate still 1.3 crores of doses in the next 80 or 90 days, I think India will be in a good position to counter the third wave. Otherwise, India's health infrastructure is already at a very fragile state, and we'll see the third wave taking a heavy toll on the Indian population in terms of lives and livelihoods as well.
Yeah, you mentioned the infrastructure and how the health system was sort of overwhelmed with this case. The variant in India has just been detected here in Ghana. As somebody who lives in India and has seen the effect that this has had on you, what advice, if you were in a position to do so, would you give to Ghana?
Well, I think the general population has to get vaccinated. The Indian vaccines, COVID-Shield and Covaxin, has been quite successful in countering the second wave. And I think in terms of long-range plan, I think Ghana has to get their population vaccinated. At least 60 to 70% of the population has to get vaccinated to counter the third wave. And as far as the Indian strategy is concerned, vaccination is the only way that we can get out of this crisis. Of course, the Indian government has been advocating the use of masks in public spaces. Social distancing has been observed at all levels at different points of time, and use of sanitizers, right? Use of sanitizers to wash our hands in public spaces, and most restaurants and hotels have been shut to avoid crowd developing, and transportations have come to a standstill. Most businesses have come to a screeching halt. So vaccination is the way forward, and India, just after just in the beginning of June, is moving towards the right direction. So Ghana as a country, to get itself out of this crisis, has to get its population vaccinated as early as possible, as much as possible.
We're having our own issues with that. We'll deal with that. But before you go, tell us about the personal impacts that you yourself have had with COVID-19, and yeah, do tell us, so perhaps we can have a more personalized perspective of this effect.
Could you repeat your question? Sorry.
How has it, I know that you run an organization, how has this affected you personally?
Okay. So personally, I think I was asymptotic as well. I was COVID asymptotic in the first wave. Fortunately, the first wave wasn't as fierce as the second wave. But I lost one of my closest uncle in the first wave. That was during August last year. In 2021, after the outbreak of the second wave, I lost two of my closest uncle as well. One was in Bangalore, and he was doing really well. Until 9:30, he was okay, but 10:30, I got the news he lost his life due to dearth of oxygen supply. But that's how the condition is. And I have lost my near and dear ones as well. So this really indicated that my family has to be on guard, and we have been following all the government protocols as such. As far the community is concerned, my business community, we have been advocating them not to go out first. Businesses means going out, meeting with clients, developing relationship. But we decided that in the community, after this the outbreak, that we'll have most of the meetings on Zoom, make use of social networking apps. Of course, now we have Clubhouse as well, contributing to the communication process. And in the community, most of us have lost our businesses. And it has come to a grinding halt. The manufacturing sector has been affected. The trainings and the education sector has been badly affected as well. Schools have been shut down for indefinite period. All the exams have been postponed to a definite time in future. So a lot of people have literally lost their jobs. Lots of life consumed as well. And transportation, public transportation especially, has come to a halt.
Speaking about transportation, Samir, sorry to interrupt you. Sorry to interrupt you, Shamir. Speaking about transportation, are there travel restrictions in India? I mean, traveling outside India, are there restrictions on that?
Yeah, it all started with the bookings first cancelled, air travel bookings first cancelled due to the increased restrictions on travel and containment zone establishments. The travel ecosystem is facing the roughest patch this year, and the situation is no different from last year around the same period. From the highest rate in the travel ecosystem, the lowest segment, which includes those who eke out a living by selling homemade foods to domestic and international tourists, near tour facilities, are engulfed by the crisis of the ongoing pandemic scare. So the government has to, come out with the relaxation of public transportation first, because public transportation is one which even allows women entrepreneurs or women business owners or workers to travel from one place to another. So this is the first thing that the government has to think about when it plans about elevating its economic level. The women who are traveling to different parts of the country for business have to be given security in terms of protecting against the COVID virus, as well as allowing them to travel to carry out their normal activities. And that's how I think the businesses and economy will open up.
All right, Shamir, we say a very big thanks to you, for taking the time to explain to us what the situation is in India. Shamir Sattar is a founder of By the Startups Business Community in Coimbatore, Tamil Nadu, in India. So, Prof, let me wrap up with you. We've heard the Indian perspective, and I want to just find out from you. As far as Shamir is concerned, the best way is to vaccinate. But we know that we can't vaccinate 60 or 70% of our population at this moment. I just want to find out from your perspective. We've been through it, but this strain is different. Are we ready in terms of our health facilities, our health personnel? Are we ready? To what extent do you think we are?
You see, in terms of our health systems, I would say that we are ready because we have had the experience and set up the isolation centers and all that kind of thing. And we have frontline workers who are very well trained to handle the situation. Our situation of protective equipments have improved. And we have better experience on how to use the protective equipment efficiently, effectively, and also in a sustainable manner. So these are credits for us. But what we have to realize is that when we look at the Indian experience and we bring it close to ours, we have to understand the realities. Our reality is that we should remember that there is short-term, medium-term, and long-term action. The provision of vaccines effort to do that should start now. Unfortunately, the Ghana Health Service has started it. And so the Sputnik Light trials, for example, and others are now in the pipeline and taking shape and going to take off. But that is going to take several months before you have the approvals for you to be able to use them. So you see, vaccine is not a short term for us. The short term for us is other strategies, some of which I started trying to explain to you and to the audience. And so the vaccine strategy is a medium-term strategy for us. That doesn't mean that we are waiting and start later. We're starting now, but to implement the vaccines at that kind of scale is going to take at least about 3 to 6 months before we can do that.
Okay.
A little longer, perhaps. And during that period, what are we going to do? Are we going to be complacent? Then we'll be overtaken like India. So we have to identify those alternative strategies that must be in place until the vaccine comes in. The vaccine is a medium-term to long-term strategy. And in the long term, the vaccine then would sustain the population and lead towards containment of COVID-19.
Prof, I'll say a very big thanks to you, and I hope that as time goes on, we'll be able to engage you more so we can hear about the dire consequences that we risk if we do not do what we ought to do, even as individuals in saving
Wonderful.
ourselves.
Thank you very much also.
Thank
you to all.
That's Professor Abraham Kwabena Anande at Noguchi Memorial Center there. Now, the Director of Public Health at the Ghana Health Service, Dr. Franklin Asiedu-Bequin, says the Ghana Health Service is ready to deal with the influx of the deadly Delta COVID-19 variant, which has now been recorded here in Ghana. Dr. Bequin is assuring that the GHS has measures in place to manage the spread. He spoke on Joy News Prime with Israel Lai yesterday.
The Delta that we are talking about is at the airport. For now, we don't have evidence of Delta in the community. But what we were doing, or what we have been doing, is that we assume that persons who are coming from those areas be having a different strain. So we now assume that their contacts who will be negative at the airport could be having the virus. So we follow them up and we test them. And we didn't get any positive case. For now, if you look at our data, there's no sense. So it's possible that we don't have the Delta. I'm not saying that we have it or not. So that's what we are doing. And clearly, as I said, we have the several system in place to detect at the airport and also at the health facility. And then we have the contact cases to follow up possible cases. I mean, clearly that's what we do. And what we need to do is to heighten up the awareness. And I'm happy about this before, that it tells you that clearly the virus is not gone. We do not need to look at that as we the early part of the year. And then people will not going back to wearing the mask. While we try to make sure we get the necessary vaccine to vaccinate. And I want to say that Ghana is not fixated on AstraZeneca or Sputnik. What we have is that we've registered 3 vaccines. The Sputnik, AstraZeneca, and Johnson & Johnson. There's a global challenge about availability of vaccines. And all efforts are being made so we get the right vaccine. But until we get the right numbers and the right number of community immunity, our sure bet is that we protect ourselves.
Speaking to my colleague Israel Lai yesterday. In fact, yesterday was when we heard the news and he was explaining our situation and how ready we are to deal with this. You've heard from the Indian perspective. You've heard from Noguchi. Now, Noguchi took in a lot of the pressure, especially at the beginning of COVID-19. Now they're saying that one of the key things that we can do is to increase or to expand our testing regime. You heard Professor Anand say that we ought to expand our testing regime. And testing regime, he's talking about focusing more on antigen tests. That way, he says, we can pick out asymptomatic people who are more likely to be spreading COVID-19 very fast. You heard from the Indian we spoke to as well, Shamir Sathar, who himself was an asymptomatic carrier of COVID-19. He's told you the number of people that he lost in his family, his uncles and several friends, all of them died to COVID-19. Now, that strain that is operating in India is here in Ghana. How we regulate it, how we contain it is what we are pursuing. And we're going to head to Zambia. We'll tell you what is happening in Zambia. The country is in its third wave of COVID-19. You've heard health authorities say here in Ghana as well that we ourselves could be on the verge of a third wave. They've said that there is no kidding that we may be heading towards a third wave. So we hear from the Zambian example. What is happening there? What are they doing? What could they do better? What can we learn from Zambia? You're still watching The Pulse with me, Gifty and Dopia. Let's take a very quick break. When we return, we'll continue the conversation. In the meantime, remember, the COVID strain from India is here. Take care of yourself. We'll be right back.